Sophie, you're a passionate advocate for consumer involvement in health and in healthcare. Tell me about what brought you to that place.
Okay, I'd have to cast my mind back because it's, I think, about 14 years ago when I first got involved, and primarily it arose as a result of having to care for a parent who was ageing and had some health issues, and having to move from the primary to the secondary to the tertiary system, and I'm talking about going to the GP, going to the specialist, going to hospital, out of hospital, back into the community, made me realise that there were things that could be done better and that there'd be a better way of working with a patient to make sure that that patient was at the centre of things. It's not an issue, in my book, it's not an issue of reducing funding or maintaining funding or increasing funding. It's actually within the current resources, how can we do things better?
So with that level of broad experience touching all of those parts of the system, where do you see the really significant gaps from a consumer perspective?
I think the individual needs to be better informed, and I think it's a partnership. If I know a little bit more about what it is that I'm being told, then I'm much more likely to have a good understanding as to why I'm doing that and to have a better relationship with my GP, and further on if I go into hospital.
So the federal government is changing their system of funding primary care and how they support general practice and other providers in primary care, and bringing in what they're calling primary healthcare networks. You've been relatively heavily involved with Medicare locals and the way they've worked with their communities, their patients and their service providers. What do you think is really important that we keep from that Medicare local experience and carry into the next phase of primary healthcare networks?
I suppose it depends on the particular Medicare local, but overall, as a principle, I think what's important is all the work that has been done around identifying the community's profile, the community's needs, and the work and the relationships that has gone into building the GP relationship in terms of supporting them and so on. At the end of the day, I feel that the community can suffer if that transition phase doesn't happen appropriately and effectively.
The new primary health network for the eastern region will cover the whole of the east, the outer east, the inner east, and part of what we currently call the northern Melbourne catchment. So it's quite a large area and a different area. What do you think are the risks for that organisation in dealing with those diverse communities and their healthcare needs?
Well, it's a very interesting question because actually when you look at the current catchment itself, it's pretty diverse and pretty complex. To join up an inner and an outer and part of a northern increases and adds to that complexity. Often when we incorporate a very large catchment, we can run the risk of forgetting smaller communities because they become less significant in the overall picture. So it's important to have the overview and to look at the big picture and the vision in terms of overall that catchment and its needs, but also to still maintain the link and the connection with the local.
So how do those communities make their needs known to an organisation like a PHN?
Well, that's interesting because it depends on the community, and some communities aren't aware that they're a community as such, and therefore they may not have a stronger voice as some other communities. So I suppose the primary health network will have to have, I would consider part of its goal and responsibilities is to actually work effectively right across the community to identify all of those groups and to find mechanisms that need to be established to ensure that those voices are equally captured.
As we move into the primary healthcare network environment, it's going to be vital that we continue to engage with our consumers and ensure that their voice is central to the new work that we are doing.